Hi, my name is Bethany, and I am the CEO of Bethany Consulting and the co-host of Managing Dental Drama. I'm excited to talk to you today about a very important topic, and that is the subject of cancellation. I will tell you from a consulting standpoint, I have seen cancellations change over and over and over again through the years, but especially since the pandemic, I have seen a massive shift in cancellations. Particularly, I've noticed that patients have a tendency to be very free with their cancellations. Something broke in that 2020 year where it became common and normal to cancel or not keep a scheduled appointment. These cancellations have continued to plague the dental world since 2020. So I wanted to give you a few tips today to try out with your particular patient base. First and foremost, I think it's important that you and your team are all on the same page when it comes to cancellations. They are incredibly costly to a dental practice. They cost time, they cost money, they cost potential production, but more importantly, they lose a spot for a potential patient that could have had that appointment. So it's important that you all get on the same page and have a unified mind when it comes to cancellations. First, you must decide what is a legitimate excuse for a cancellation. What's going to be okay with you guys? We hear right now that sickness is commonly the most stated reason for a canceled appointment. It's hard to argue with sickness. When do we push back against that? When do we penalize a person for canceling for a stated reason of sickness? So you need to decide with your team what is an acceptable reason of cancellation. Is sickness going to be one of those? And what qualifies as sickness? I've got an itchy throat, I've got a little bit of congestion. Is that going to count as sickness? Or are you going to have some clear parameter like a fever or some type of other reason that you would count as sickness? So get with your team and decide on what's a legitimate reason for canceling. Once you've decided on your legitimate list of reasons for a patient canceling, all other reasons should be illegitimate, meaning that they're not acceptable. And at the end of the day, you have to put boundaries and parameters in place. Now, I am going to break from the norm here and say that I do not love cancellation fees. They tend to create angry patients, they tend to create problems for the team, and ultimately it's just not a good persuader to that patient to keep their appointment. So I'm going to encourage you to think outside the box a little bit. Now, even though I said I don't like cancellation fees, I think you need to have a written cancellation policy that's very evident in your patient paperwork. If you do not have this policy in your patient paperwork, then a patient can argue with you saying that they didn't understand your cancellation policy. So it's important that you get that into some type of document, or if nothing else, just at least posted in your office somewhere for the patient to see. It's better to have a patient's signature so that you can hold up your end of the deal and the patient can ultimately hold up their end of the deal. So get a cancellation policy in place, and that cancellation policy should be written to be the most extreme or the most rigid of a policy. You don't want to go loose on your written policy and then be firmer in your implementation of your policy. You actually want it to be the opposite. You want to go firmer in your written policy, and then you have the ability to be loose as needed with judgment in the implementation of your policy. Now, I do recommend that cancellation policy mentions something about potential fees charged for missed appointments. Now, if you have a very clear cancellation policy already and you know what that fee will be, put it in there. I think it's totally fine if it's $100 an hour, if it's $50 per appointment, whatever your policy currently is, you can put it in there. If you're unclear on your policy, put something in there about charges that could be assessed to any short notice cancellation. Now, I mentioned short notice. This is another thing that you and your team need to decide upon. What is considered short notice? Is it same day cancellation? Is it within 24 hours? Is it within 48 hours? There's lots of different parameters. So you guys need to decide what is considered an appointment canceled worth penalty. And that's an important distinction for you and your team to have. Once you've gotten a written policy in place, I do want to tell you, if you haven't had your patients sign off on those policies before, that's an important thing to do. So if this is an updated policy that you're making, you need to roll it out to your entire patient base. And I recommend having updated policies signed on an annual basis. That way you can make changes, edits, and the patients get accustomed to signing paperwork on an annual basis. Now, we've talked about policy. Let's talk about the actual implementation of dissuading a patient from canceling an appointment. There's a couple different schools of thoughts that you need to think about. Number one is you can begin to charge a reservation fee for appointments scheduled. Some people call this a deposit, an appointment fee, a reservation fee. Call it what you may. It's the way of the world right now. If you book anything, you're normally having to pay some type of deposit. About flights that we take, car rentals, hotels. This is the normal world of scheduling appointments now and reserving something. So this isn't abnormal. Even if it hasn't been the case in your particular practice, patients everywhere are becoming accustomed to this type of world. So I think some type of reservation fee or appointment deposit is an important thing to think about for your particular patient base. Now, a lot of times I hear, but they don't have to pay anything for hygiene appointments. That's changing, but most of the time they don't have to pay anything for hygiene appointments. So how would we collect a deposit on that appointment? That's a fair question. So some offices that I work with, they do an appointment fee no matter what, whether it's treatment, whether it's hygiene. There is a refundable $50 to usually $100 deposit. Now, in practices that do larger appointments, especially large treatment appointments, they will sometimes equate it to a dollar amount per hour. So if the patient has a 2-hour appointment scheduled, they might have a minimum $100 per hour deposit that they place on file. So in that particular case, the patient would pay $200. I think you can decide whatever works best for you, but I also think that deposit can work towards hygiene visits. Here's a couple of things to consider with hygiene visits. First of all, insurance is becoming a little bit more tricky on what they cover and what they don't cover. There's plenty of insurance companies that are applying the deductible now to either preventative type things or to x-rays. So that $50 deposit, let's say, could come into play with the patient actually owing something for their hygiene visit. Also, insurances usually aren't paying for elective preventative procedures like fluoride. And so that $50 deposit that the patient places could easily go towards charges like that. But in a worst case scenario or best case scenario situation, that $50 deposit is simply refunded back to the patient when they show up for their appointment. So deposits can work even for hygiene appointments. I like deposits better than cancellation fees. First of all, it's already been paid and you're not having to chase after that patient for their $50 cancellation fee, which they don't want to pay anyway. And when they do pay it, they're going to be angry about it. But this reservation fee is something that they've already paid towards that appointment, and they're well aware in any appointment that they go to that that deposit's going to be consumed if they fail to show up for that appointment or cancel without the appropriate notice. So consider this strategy as something that you might do for your particular patient base. Change is hard in a practice, but at the same time, your patients are moldable and malleable. We just have to have consistent messaging when we roll out a change like this. We can let them know, hey, we've had a really tough year with patients canceling their appointments last minute. And although you've been a fantastic patient, we can't discriminate with policies like this. So we are rolling out a reservation policy, and it's simply going to be refundable to you when you, who are great about showing up for your appointment, come to your appointment. It'll be refunded back to your card. The other option is to keep a credit card on file. If you don't want to go through the hassle of the reservation fee, I get it, it's a new change, then you could always keep a card on file, which is then being promptly charged when somebody doesn't show up for their appointment. There's some problems that can occur with this, particularly credit cards expire. they go out of use for various reasons. And so that isn't a foolproof method, but you can always choose to go that route as well. So then you are assessing a true cancellation fee, but you have a card on file that you can charge right away. These are just a few tips. I've got lots more thoughts that will come in subsequent videos, but I hope these initial tips have helped you tackle the problem of canceled appointments. Best of luck.